Welcome back. This is Mod 3, Week 3 of the Open Heart Counseling and Training Services, the certification, the spiritual certification of grieving counseling course. Okay. And so this is the Mod 3. We're going to be talking about premature grieving. Okay. This is the video, the YouTube video for Mod 3, Premature Grieving. Okay. So what is premature grieving? Even when I was putting this course together, premature grieving, I said substitute grieving. So that word kind of stood out to me. Premature grieving, substitute grieving is when you tend to prematurely move on in your life without dealing with hurts and traumas. Emotional and mental state. We shove the pain inside rather than getting professional help or getting the help that we need to be able to move forward. Okay. And so we're talking about premature grieving. Okay. When I say we tend to shove the pain inside and live as if nothing has happened, well, how many of you know that it doesn't matter how much you shove it inside, it eventually leaks out. It comes out some kind of way, whether in anger, alcohol, drugs. You're doing something to premature grieve because you're not grieving properly. Okay. I said premature grieving can also cause you to jump into relationships that are not good for you. Most women end up in abusive relationships where they're looking for validation and love. Some people end up alcoholics and drug addicts. Some become addicted to sex for the pleasure of comfort. What are you prematurely using to try to get over grieving from a loss or traumatizing situation? And that's a question that you want to ask your client. Are you prematurely grieving? Are you using anything to premature grieve, or have you been using anything to prematurely grieve before you came into my office? How have you been dealing with grief prior to you coming in here? And so that's another issue that you would have to deal with. You would not only have to deal with grieving, you have to deal with the grieving from the loss of the person. You have to deal with if they dealt with something from the person that was maybe abuse or mistreatment. And then on top of that, now you're saying, okay, so what have you been doing prior to coming into the office? Have you been prematurely grieving? Have you been drinking? Have you been on drugs? Have you been sleeping a lot? Like, what is it that you've been doing to try to get over what you've been trying to get over? Okay. And so it's very important to be true, that your client be true to themselves. So then you can be able to fully help them grieve the right way. You got to understand that grieving is not easy, especially when you was never taught how to grieve, but to always suck it up. Why are you crying? You're a man. Men don't cry. These are the things that you're told as a child and growing up. And so when it's time to grieve, you don't know how to grieve properly because you was never properly taught how to grieve. You always suck up time. You shouldn't shed a tear. You're a man. You should have been crying. That's why it's hard for men to cry now, because they feel like if they cry, then they're punks, or they feel like if I cry, then I'm less of a man, which is not true. That was just something that they wasn't taught correctly. Okay. Then there's a saying I put in my book. There's a saying that men not supposed to cry, and I said I beg to differ, because as a counselor, I see individuals all the time that haven't been taught to cry. They need to be taught that it's okay to cry, and I said, like before, especially men. Okay. The process of grieving does vary depending on each individual and what they have lost. No one can put a time limit on grieving because everyone is different. But as you continue to figure out what's best for your client, you will, maybe come into like a treatment plan, try to come up with a treatment plan, or it's not a time frame, but it's just like a plan. You're planning, okay, so maybe at this point, maybe they should be here. We're going to work on this and try to get you to this point, from point A to point B. And so you're actually going to come up with a treatment plan to help them go from point A to point B. So when they look back, they can say, okay, so I got over A, so now I'm moving forward, okay? And so that individual will know when they're okay, when it's time for them to stop coming to see the grief counselor, okay? The situational loss may have been the same, but the grieving process is different. For example, someone can grieve and be okay within a few months, but that might not be the case for you. So don't get discouraged when you see someone handling their trauma or hurt differently from you. That in itself is not healthy for growth. And so you don't want to, even when your client comes in, you don't want to compare them to any of your other clients. Well, such and such just went through the same thing, and after 3 months, they was over it, and I feel like you should be over it. No, you can't say that to your client, because you're going to actually run them off. You're going to make them feel like they can't trust you. And so what you're doing is you're just actually taking your time with your client, and you're working them. As long as they want to work with you, you work with them. And you allow them to learn how to grieve properly. You help them grieve properly, okay? And so the more you are true to yourselves, the better you will be able to deal with hurts and pain. And that's something you want to tell your client. If you're true to me, you're true to this counseling session, then the better you're going to be able to deal with everything and be able to move forward in your life, okay? Let me see. Most individuals tend to look at other people for healing, and which is okay. But at the end of the day, it's you. Only you can carry your feelings and emotions. Only you can say when you feel you have been healed of grief and the grief you have experienced. And so, yes, so as an individual come to you for counseling, it's still in their hands to do what's necessary to be able to be healed, or necessary to be able to move forward. Because healing may never take place. It might take place like 6 months later, but as long as you are going through the grieving process, that's all that matters, because nobody can actually put and pinpoint when a person is really going to be healed. I don't think if you experience a loss, you're really never healed. You actually just learn how to deal with the new normal life that has been given to you. Like I said in that quote, you just learn how to function. You learn how to not allow the death or the loss of something to control you, but you control it. And so that's the difference in, losing something and just being all over the place, than losing something, but coming to a grief counselor and saying, I'm going to deal with this thing the right way so I can be able to move forward. So nobody's promised that your heart will be totally healed, even until you leave the earth. It's going to always hurt. Even in relationships, you lose somebody. It's this little feeling always comes to remind you that you used to love them. And so you have to understand that, things just don't happen overnight. They don't happen over 2 or 3 years sometimes. It just depends on you and, how you deal with things and what you're doing to deal with it. And that's how you have to go forth in dealing with your grief counseling, okay? Grief is something that is personal. It might take 5 years to get over a loss, but it may take some 2 years. But that shouldn't make your grieving process any less important, okay? So everybody's grieving process is important. And so when your client comes in, you want to make sure you are telling them, this is very important. And you have to make sure that they know that their grieving process is important to you more than it's very important to them, because they want to know that they can come in here and be free and be able to explain themselves, express themselves, and they know that they're going to get the help that they need, okay? Knowing you helps you understand what and how long your grieving process will take. And so as much as the individual knows themselves or the client, if they know themselves pretty well, what they deal with, how they deal with things, I think they have a kind of a feel of how long it would take them to actually be able to move forward in their life without allowing the loss to control them, okay? So never give someone that much power over you to control how you deal with life situations, okay? So, you might have a wife or a husband or a friend or someone saying, it doesn't take that much. You should have been crying. It's been 5 years and you're still doing this and that. Don't allow people to do that to you. You might have to cut some people off if they're not being considerate of your grieving process, because if they can't understand where you are when you have lost somebody and you're grieving, then they shouldn't be in your circle. You want people around you that's supportive. You want people that's around you that's telling you it's okay. I mean, you don't want people to allow you just to lay there and die, in the situation. You want people to push you and help you say, it's okay, get up. I understand where you at. But you don't want nobody just telling you that, why you still here? It's been 5 years and you still crying over this person. They're gone. They've been gone. Move on with your life. That's something that as a counselor, you do not want to tell your client, okay? You do not want to tell your client that. You want to make sure that you are supporting them in their feelings and their emotions. You want to make sure that you are hearing them out. You want to make sure that you're telling them it doesn't matter how long it takes. As long as you come, I'm going to help you. You want to be their it's kind of like you want to be their backbone. You want to be their support system, okay? And you might be one of the ones that say, okay, I have a support system. I have my counselor, I have my mom, I have my brother. And so if they add you into their support system, then that lets you know that you are important to them and what you're doing is actually benefiting them through their grieving process, okay? And so I went over premature grieving. That's mod 3. This is the last video. It's 6 mods in the 6 weeks course, 6 mods in the spiritual grief counseling certification course, and the premature grieving was mod 3, and it was the last video, okay? And so I'll see you guys in the next video. Once again, this is Open Heart Counseling and Training Services, a center where we are training and we're equipping people to learn how to deal with mental health on all levels. There will be more courses that I will be putting together to be able to help the community be able to deal with foster kids, abused women, domestic violence, all walks of homelessness, just all types of things that people not only just, they need help, they need training, they need counseling, they need love, they need support. And so this is what these courses are doing. They're equipping the people that's in leadership to be able to help in different ways. And so once again, this is mod 3, premature grieving. I'll talk to you guys soon. You guys have a blessed day.